Welcome to CSG's Spotlight On. I'm here with Dr. Brian Chang, discussing acupuncture and East meets West today. Doctor, welcome.
Hi, thank you for having me.
Please tell us a little about yourself.
I graduated from Columbia University and I worked in the corporate finance world, and I worked specifically in the areas of biotechnology and also management and strategic consulting for pharma companies, ranging over issues from speaker med programs to compliance issues with the FDA. And I actually got in a horrible car accident, and after hitting a dead end here in the States, because I did have some nerve damage and serious injuries, I went to Asia and Korea specifically and got treated and improved my hearing loss. I had originally a hearing loss of 70%, went down to 15, 20%, 25%, and my tinnitus was pretty much almost resolved completely, and my smelling was returning a little bit. So I had some serious injuries, and after that I continued to work in the finance world and decided to change careers and follow my heart, and I feel that what I'm doing now is something I completely love, and I've been doing it for about 6-7 years now.
That's great. That's great. And a valuable piece to the CSG team here as a medical director. Tell us about some of the misconceptions about acupuncture.
Acupuncture, one of the misconceptions is that it runs along the nervous system or blood vessels. It's actually completely independent of the two. If you put a map of the nervous system and actually all the pathways and meridians, all 74 of them, you'll see that they are not, they're completely independent of each other. Of course, there are some points where they might be over the nerve, but they are complete independent systems. Some of the other misconceptions or questions is that acupuncture hurts. Acupuncture, it doesn't necessarily hurt. Sometimes it can, but usually it's a sensation of qi, energy. And to a lot of patients, it's an unknown feeling. You can feel like a static electricity. Almost feels like when you blush in the face. You feel that energy, blood going to your face. That's what qi feels like. So when a patient feels that for the first time, and it might feel like heavy, burning, or even static, or almost like electrocution, they don't know where to categorize it, so they might put it in pain. And once you tell them what it is, they usually realize that, oh, it's not pain, it's qi. And any other misconceptions that I can think of is that acupuncture is some sort of hokey, mystical medicine. And it's not. There's a whole complete, very detailed, thorough pathology that is rooted in acupuncture and Eastern medicine. So that it's something that a lot of people don't realize. So for example, if I have 5 people with acid reflux, in Western medicine, they'll prescribe the same medication to all 5 patients. In Eastern medicine, we're treating the individual, not the disease. So therefore, each person might have acid reflux for different reasons. One could be stress on the liver, irritable, stressful work environment, which affects the heart, which promotes acid reflux. Another person could be their dietary reasons for digestive systems. So that's probably some of the misconceptions that people have.
Okay, that's helpful. Thank you. Talk for a minute just how you see the insurance industry and acupuncture changing in the years to come, whether short-term or long-term.
I think in terms of PIP, I believe that acupuncture will be expanded. I think that the prescription referral necessity will be dropped eventually. I think people will start realizing how effective acupuncture is for treatment. And I also believe that in the major med scene, acupuncture has become more popular, and you see more and more people requesting it. And it goes from celebrities like Gwyneth Paltrow, who several years ago did a cupping procedure on her back and went down the red carpet with open back dress, showing all the circular marks from the cupping, to NBA players like Shaquille O'Neal, who got acupuncture regularly for his knee problems. So as we move on forward, I think you'll see much more integration into acupuncture. And we already see it in the major institutions, such as Memorial Sloan Kettering Cancer Center, to UCLA Medical School, to Dr. Oz talking about it when he does his surgeries, and so on.
That's great. That's great. Well, thanks. I appreciate the time today. And for Kevin Rollins, Dr. Brian Chang, here today at CSG Spotlight On. Thank you.
Thank you.
Perfect.